So I'm going to turn it over to the presenters and let them take it away. And I'm very grateful that you're all able to do this tonight. Thank you very much.
Thanks again for having us. So I'll kind of start us off, and Ellen, Amy, and I are all going to talk about a few different aspects of mental health care, knowing that we might say everyone's mental health has been affected recently over the past several years. And so we want to think about not only people with CF, your kiddos, but also how families are doing as well. So we thought we would start, and this may take some of you back, but this is data that was collected years ago. You see this was published in 2014, where they did a big international study. It was called TIDES, and they looked at rates of anxiety and depression for people who have cystic fibrosis, as well as moms and dads. And this kind of is just an important figure to keep in mind, because you see the rates were already higher than the community. And we can think about reasons that may be. Living with a chronic illness is what we might assume is a big part of it. But you also see really high rates for parents, right? In terms of anxiety, we almost have 50% of the moms endorsing symptoms and 36% of dads, and similar numbers to some extent with symptoms of depression. So we've known this for a while, and this is why the CF Foundation many years ago said, hey, we need to make mental health a part of what we do. When we even say the words mental health, some people say, well, can't we just say health? Mental health is part of your health. The CF community has a big slogan now that there is no health without mental health. And we really need to think about the impact of chronic living, of being a teenager, of having parents. We know parents can also give us anxiety disorders. That's me joking, okay? But and just thinking about how we are then taking care of people as a whole person, not just as a medical diagnosis, for example. So we're going to walk you through, in some ways, a few of the headlines recently, and then talk about some of the resources we have available in our center, as well as some that have been made available by the CF Foundation. And then we're going to give you a few strategies in the end that were developed in part for people who were going through ongoing trauma. And I think we pulled this in particular because the last few years have been pretty traumatic for many. And so we're talking outside of cystic fibrosis even. We're thinking about what's going on in the world, about COVID, about things going on in our community. And so we wanted to offer those tools as well for you and your family. So I'm going to turn it over next, I think, to Amy. And again, this is kind of, or Ellen, I'm sorry, a walk through some of the headlines.
So we pulled together some articles, and you can see just by reading the titles alone that kids are struggling with mental health issues. In the first article, they mentioned something that I found very interesting. They said that young people are more educated, less likely to get pregnant, less likely to use drugs, less likely to die of an accident or injury. And by many markers, kids are doing a fantastic job and are just thriving, but there are really important trends in anxiety, depression, and suicide. One of the statistics that they mentioned was that in 2019, that's prior to the pandemic, 13% of adolescents reported having a major depressive episode. That's a 60% increase from 2007. In the next article, the American Academy of Pediatrics mentioned that mental health disorders have surpassed physical conditions. And they mentioned wanting to see mental health through a prevention lens and stop seeing physical health as different from mental health. Like Mary Beth said, the CF Foundation in 2015 had the focus of the NACFC as there is no health without mental health. And so what can we do about this? The articles mention several steps that parents, caregivers, providers can encourage people to take, and that is to recognize the signs. Talked about that anxiety and depression are different issues, but they share the same indicators. That parents should look for changes in behavior, such as disinterest in eating or altered sleep, and that teen in distress may express excessive worry, hopelessness, or profound sadness. They suggested to approach with sensitivity, to be gentle and curious, to have conversations with their teens, don't shy away from hard questions, and approach the issue with compassion and not blame. They said to ask open-ended questions that are thoughtful and sincere, and ask permission to share your suggestions. Next thing they suggested was to offer healthy ways to manage emotions, and to encourage practices known to help with well-being, such as exercise, meditation, journaling. They suggested to get the correct diagnosis, whether it's anxiety or depression, and to carefully consider medications, maybe asking the provider what specific drugs might be appropriate, what the side effects were, and any interactions with other medications, as well as how to tell if a medication is working and how hard it would be to wean off. And finally, they said, don't forget the basics. Young people with developing brains need 8 to 10 hours of sleep to promote mental and physical health. And that lack of sleep can interfere with development and dramatically impact mood. And with that, I will hand it over to Ellen for the next portion.
I would say one thing before I cut off Ellen would be, when we talk about recognizing the signs, know that that's what your mental health team is also there to help you do. It's also why we screen at least starting at 12 years old for symptoms of anxiety and depression. And as Amy said, these can often overlap. And another thing that is hard is many of those diagnoses also include somatic or physical symptoms. So for example, changes in sleep, appetite, energy can also be related to anxiety and depression. So important that we again think of people in this whole self context, not just in context of one symptom.
All right. Thank you, Mary Beth. So we have put together several resources. So we know that this is happening. We know that the rates of depression, anxiety, and in some cases, suicidal thinking or self-harm, we know that these things are happening. And so what can we do to support? What can we do to provide that safe place? And there's actually lots of resources. There are a lot of things available. I think, so we have a list here that I think we can distribute afterwards, right? Okay, I get a nod from Mary Beth. So I think we can definitely distribute this. And what it is, it's 2 full pages and a 3rd page of different resources, and they're hyperlinks, so you can click on it if you have want resources around specifically depression and CF, anxiety and CF, the screening process, coping with your own mental health while caring for somebody. And so these are great resources. I'm not going to read the whole list because, like I said, it's 2 very full pages. So I'm not going to go through it, but we will be able to share it. On this list does include a few of the items here. And I just want to kind of point out some of these to you because they're listed here because they're really good. They're well known. They offer real support in a lot of times in real time, which is wonderful. So first and foremost, the CF Foundation is available to you through Compass, and they can provide lots of resources and information around lots of different topics. You may have had a conversation with either Amy or I about insurance or financial resources, and we may have directed you to Compass. They can provide lots of different kinds of resources, not just around the financial concerns that some people might have. Also through the CF Foundation is the CF Peer Connect. And so that's available to anyone in the CF community, a caregiver, a child, an adult with CF, 16 or older, I think is the caveat there. To connect with somebody, to connect with another person who's maybe been there, another parent who is struggling with the same behaviors with their young child or their teenager, and maybe an older child to connect with someone younger. And so that's a great resource that I think that we don't talk about as much as we should, because it's a really good resource for this wonderful community. excuse me, the National Suicide Prevention Lifeline is available to anyone 24/7. And then you get to talk to a real person in real time, share what you're thinking, share what you're feeling, and they will make sure that you're safe and call somebody if they need to come get you, but also just somebody to talk to, somebody that you can really kind of share what's going on. Similarly, there's the teen line, which is, as it says here, staffed by other teenagers who've been trained, right? So it's not just like you're calling up, someone's best friend, right? That wouldn't really necessarily be helpful. Well, maybe some cases, who knows? But these are teens who've been trained. These are teens who, are provided supervision, who can relate on that peer-to-peer kind of level for those that might not be 16, who might not be eligible for the Peer Connect. It might be a good resource. I'm sure a lot of people have heard of the Trevor Project, which supports our LGBTQ community and offering lots of resources beyond mental health, but specifically around mental health as well. And then these, all of these links, we'll be able to send out the slides to you afterwards, and all of these links are clickable, so you can get more information immediately. There were just a couple of, or really one other thing that I wanted to point out. Actually two other things that weren't listed here, which I can share in the chat in a little bit. Much like 911 for a medical emergency, the number 988 will be going live across the country starting July 16th of this year. And so for a mental health crisis, that's a really simple number. So share that with people, let people know that exists starting July 16th. There will be a very easy number to remember, just 3 digits, 988. And then similarly, there is a text crisis line. And again, I can put this information in the chat in a little bit here. And I'll put the number in and what you need to text and all of that. You can text through whatever your messaging app is on your phone, or WhatsApp is a common downloadable app that people use to send messages if you're worried about data rates or text fees or anything like that. So I want to add those two. And with that, so I think I will pass it, I think, back to Amy for one more slide, and then we'll keep going on.
So this is more specific to CF than the first articles that we talked about. And so just as a review, some of the stressors that are associated with CF for both caregivers and our patients is the unexpected diagnosis of a lifelong genetic condition, keeping up with burdensome daily care regimen, social isolation and feeling different than their peers, and disclosure of illness to family, friends, and others, impact on body image and eating behaviors, disruption of personal life goals, activities, and relationships, financial stressors, complexity of healthcare and insurance situations, and coping with difficult physical symptoms, medical procedures, pain, hospitalizations. So mental health providers in general can treat all things like depression, anxiety, ADHD, trauma, substance use, chronic pain, and distress from medical procedures. We can refer our patients and even our parents to providers in the community. But some of the things that we can do in the clinic are these things listed here. Promoting wellness through sleep. We had talked about that. Mary Beth had highlighted that. Getting physical activity, getting good nutrition, and understanding how the mind and body are connected. We can talk with our patients about how to improve or sustain their self-care and how to stay adherent through motivational interviewing. And we can address the impact of CF at the start of school, talking to peers about what kind of medications they're taking at lunchtime, disclosing to significant others, taking their first job and or going to college and disclosing to their disability offices or to their employer, and just helping people throughout their time in the pediatric clinic until they move on to adult care. And our goal is to continue to build our relationships with our patients and our parents, so that when there is a difficult or a bump in the road, we can be there and already have that relationship. In the event that we would refer our patients on for mental health in their community, we do have a PowerPoint that we send along before the patient goes to counseling, just so that that provider will have a good idea of all of the things that our people with CF have to deal with, in addition to typical life stressors, so that our patients aren't spending a lot of time educating about CF in general. And with that, I will pass it on to Mary Beth.
Sure, thank you. And I think great things to highlight, as well as, we are able to provide some therapy in clinic. We also have some access to psychiatry if we're thinking about medications, but really want to think with you all, the CF Center says 12 is when, or not CF Foundation, but we're saying at 12 years old, we're starting screening. There's a lot going on before 12, and there's a lot going on at various stages throughout someone's life, and wanting to be along with you throughout your time in the CF Center and beyond. I think Ellen was going to talk about a few of these articles, which is then talking more so about parental mental health.
So you might look at these headlines and think, well, yeah, that we know that, right? We've done this for a while. We've done the pandemic since before that second article was written. So yeah, we know, right? We know that these things are happening. But I want to point out just a few things that they do discuss in the articles, and then offer some thoughts for parents as well about taking care of yourselves, so that you can then be there for others, but also just to sort of maintain and provide support for yourself and connecting with your community. So some of the things that I'm going to share with you about both of these articles may or may not come as a surprise. You may have experienced some of these things yourselves. And so the first article talks a lot about how being a parent is just hard, especially, to a brand new baby, or maybe someone who's living far away from their family. And so a lot of people work really hard as they become a parent, or as their children grow, to develop community or be engaged in different activities, whether it's, a mommy and me class, or a child is engaged in something while a parent can then have grown-up time. And so one of the things that this article talked a lot about was that as the pandemic started, these things were essentially ripped away. These things were sort of no longer available, or were only available virtually, which I think we all know creates its own set of challenges, especially if you've got, a little one running around. It's hard to really only have grown-up time, when that little person needs your attention. And so because of this, about 50% or so of caregivers, so I want to say not just parents, those who are providing care for young children, and even disabled adults, had indicated that at times they had some suicidal thoughts. So this is sort of the level of extreme mental health that we're talking about, where these parents are really struggling. And so it talks a lot about the need to really destigmatize a lot of these things, so that people can feel more comfortable reaching out. And that's one of my hopes always when talking about mental health, is that people can feel a little more comfortable the next time, maybe asking a question or reaching out. And so again, it sort of highlights the need for community, the need to have your people around you, and engagement. So again, that may or may not be news to you. But the second article talks again, and so you can see from the headline that this really is a mental health crisis, and it continues to be. We just began to sort of identify it at the beginning of the pandemic. And so again, a lot of those resources all of a sudden became virtual, and people had a harder time connecting with each other. And so one of the things that this article really focuses on is the importance of that connection, the importance of sort of an emotional connection with another human being, especially for a single parent or a single caregiver. The rates of mental health needs really decreased when there was another grown-up, when there was another adult that person, that caregiver, could connect with. So I just want to also offer a few very, very simple self-care kinds of ideas. So I think that one of the things a lot of people think about with self-care is, it's a spa day or a bubble bath with a glass of wine, or it has to be like this big thing, right? And ultimately, that's great. That's fantastic. If that's your jam, then hey, I love it. More power to you, right? Go get a manicure and a glass of wine. But that's not necessarily the day-to-day kind of self-care that we're talking about. And so self-care on the day-to-day might be pretty simple. People might even consider it kind of boring, but it can be taking time to go to bed early. Don't stay up and clean your house. Go to bed. It's okay, right? Taking a walk, even eating a healthy snack or a healthy meal, preparing that meal. These are things that take care of our minds and our bodies. Very simple. Or ordering a healthy meal if cooking the meal is not right. I am a big advocate of doing what makes sense for you. Taking your medication, right? That's really important for all of our kids, but for parents and adults as well. That's a great form of self-care, making sure that you're doing that. You're using your support system. 5 minutes of adult conversation can go a long way. So yeah, I just want to kind of point out that there's a lot of different ways to care for yourselves, because we recognize that this mental health crisis is affecting more than our children. It's affecting everybody, parents included. And I think Mary Beth.
All right, so thank you. That picture, I don't know, let me see if I can go back. For anyone, I tried to put some pictures in here because I think sometimes they say more than how I feel, right? And I'm like, just look at this. But so I wonder if there are ones that can describe how you felt recently. But what I'm going to do now is take you through something called stress first aid. And this is going to repeat some of the coping strategies you've heard, but also perhaps give you more insight into the types of stressors you may be facing. And then we'll offer again some ideas of coping strategies that may include things like when you think of self-care, when I'm talking to adolescents or kids who are feeling really depressed, self-care may look like getting out of the bed or brushing my hair, right? And that may feel very small for some people, but sometimes it is getting started somewhere. So the Stress First Aid was developed by the National Center for PTSD, or Post-Traumatic Stress Disorder. They developed this for the military originally, for people who were exposed to ongoing trauma or repeated trauma. When I use the word trauma, I often ask people for permission to describe something as traumatic, because we all may define things differently. Many teens, young adults, parents have said the pandemic has been traumatic, right? I appreciate it when my husband says we are in survival mode. And so when the sink is full of dishes, I'm like, that's right. And in survival mode, they can be dirty, right? So thinking about what may be traumatic is CF traumatic, is graduating high school, being virtual, is what has recently happened in various school settings or with regards to other social concerns that have been prominent for our country. And so the military, they define these 4 types of stress injuries. And so the first is what they call a traumatic injury. It's what we often think of when we think of trauma. So experience of or exposure to something very worrisome, or where you might even be worried about your own safety. So for example, I have kids saying to me, worrying about going to school. Am I safe at school? Now that even comes up for kids with a chronic illness, right? And has previously, should my child be homeschooled? I'm worried about how, exposure to different things, or I'm worried about their safety. And so thinking about life threat as one, perhaps, stress of the past few years. Another is loss or a grief injury. And what we don't just mean is the loss of life, so someone dying, but it means also what I think is really important in this is parts of oneself. So Ellen alluded to this, or many times, the idea that the pandemic took pieces away from us. It took me being a person who went out and functioned in these different areas. It took away some of my coping strategies, right? And so families who said, I missed my 5th graders graduation, saying, but we survived. And so I hear that, and that's great perspective taking. And it's okay to acknowledge the losses that you've experienced. Another loss that comes up for us sometimes is parents saying the loss of a child who doesn't have CF, or what I was hoping for. That's changed a lot recently with advancements in treatments and Trikafta, for example. But loss is something we often think of or experience and don't always acknowledge. Another stress injury is inner conflict, or what they call moral injury, something that I think has perhaps been more prominent for many recently. This is not only witnessing things that violate your morals. So for example, people being treated equally, but also when you feel like perhaps you're forced to act against your morals as well. I think vaccines is something that has come up for people, and I don't have to open that conversation, but thinking about conflict that people have had in terms of safety with regards to pandemic. And then the last that I think I should ask everyone to raise their hand, because I assume you have experienced it, is this at some point in your life, if not very frequently, is wear and tear. It's called a fatigue injury. So it's the accumulation of stress. And what you see is important here is without sufficient rest and recovery. And that's hard to define. What does rest and recovery look like? It's not fair to say, I slept last night, therefore I'm ready for the next day. Thinking about how do I get back to my whole self, especially when I keep being faced with exhausting situations or stressful situations. So this is something, we have a handout I developed with the Mental Health Advisory Committee with the CF Foundation that we send out to centers that we have for you all as well. It's a front and back, and I'll take you through some of this, and then you all can ask questions about this, and then also just discussion in general. And I'm sorry, there's a dog chewing very loudly on a bone beneath me, but hopefully you can hear me. So these are called the 7 C's of stress first aid. And that's a play on the Navy, because again, it was developed for the military, the Marines, and the Navy. So think of the 7 C's. And what they recommend, or they found, is that these are most important for people's mental health in ongoing exposure to trauma, or generally. And so there is no magic formula for which ones you need or how much you need. You don't need all of them. Some people may say what's really important to me is confidence, or others may find a different area they would like to work on at different times. It's just important for you to think about what may be most helpful. So the first C is called check, and that's really you noticing, hey, take a minute and body scan or think about, how are my emotions? What have they been like? I think for me, sometimes my immune system tells me before my brain how I'm doing. It's like, oh, wait, I have a cold. Oh, wait, my stomach hurts. That's a sign to me that something, I might be stressed. Coordinating is really you then seeking support, whether it's through the list of resources that we've provided or your mental health team at UNC and other places to think about how we can better serve your kids and you all. Okay, and then these next 5 C's are the essential ones that they talk about. The first one is cover. So if you think of taking cover in the military, it's keeping yourself safe. And what we think about is with respect to physical safety, health in general. And again, pandemic was really nerve-wracking for people and also now kids in schools. So thinking, how can we help people feel safe without presenting this, I'm trying to think of the right word, inaccurate sense of safety. And that's been really hard. Parents saying to me, but I don't know, how do I reaffirm that they are safe? So thinking about more mindfulness techniques. So when you're in the moment, you're doing everything to keep yourself safe. We have this plan to keep yourself safe. We can talk a lot more about some of these, but want to just highlight that one and see if that's something you all have experienced. The next one is calm. So I like some of the words that they associate with calm, one of them being finding a place that's quiet in your mind and your body, finding a place where you feel composed, seeking rest, and then also a chance to feel soothed. Those are really important words I don't always think about. So again, quiet, if that exists in your house or your mind, composed, rested, and then soothed. I like to go through with people a lot of different types of positive emotions, not just good, bad, happy, sad. We forget about different things that might be in that category, like soothed, comforted, joy, calm, peace. And so figuring out how you find that. You'll see deep breathing is on here. And usually when I mention that to teens, the eyes roll, right? Little kids think it's more fun because we can teach you how to smell a flower and blow out a candle. It is really helpful. We know when you expand your diaphragm, your lung capacity is bigger. But I also remember having a mom who was a psychologist as a child. Whenever she told me to take a deep breath, I was ready to go back at her. So it is important to practice that, but you see, I did not have calm when my mom encouraged me to. A next one is connection. This one is hard for people with a chronic illness who aren't able to be around others who have the same chronic illness. You'll see Peer Connect is one example of how the foundation tries to provide some of that peer support. We do some of that within our center as well. But connection, I like to joke that there are kind of some love languages of connection, and you have to figure out which one is most helpful for you or for your child. And so the different ones might be, and just when you think of connection, thinking of being with someone is a great thing to keep in mind. And so when you're connecting, does it have to be that I'm talking, or can it be that I'm present with someone? I think that was a big thing people missed during the pandemic, is just being next to somebody. But the love languages of connection, the first one is instrumental support. So it's based on evidence. So I can say I'm not stereotyping, but within the military, instrumental support was most appreciated or welcomed. So this is when someone does something for you, and that's a sign of connection or support. So for example, they do the dishes for you. They get you a cup of coffee. They do your laundry while you're at college, right? They send you a care package. And what's generally most well received is also when someone does it. So as opposed to saying, would you like if I did this for you? Now, both are accept or appreciated, but sometimes it's easier for people to say, no, don't worry about it, and then not receive that connection. So that's one love language. The next is informational support. So sometimes to feel connected to the world or to others, we want to know what's going on. I know I keep talking about the pandemic. I'm sorry. I'll use it as an example. I'll try just one more time. But I remember getting weekly, daily emails that were like, you must read this, know what's going on here, and thinking, oh my gosh, I must stay connected. And finally saying, whoa, this is not my love language right now. I do not want to watch the news. I need a break. So thinking for yourself, are you an information seeker? Or are there times when you don't want that information? And then the last is emotional support. So someone you can vent to, you can, who will listen to you. That's always something I tell kids. Tell your parents if you want them to listen or problem solve. Listening is very much the most common answer. So how are you connecting? But also in that connection, what are you looking for? Is it someone to be with you? Is it someone to laugh with you? What emotion within that connection is helpful? Competence is something I look for daily, right? And it's so you feeling that you are doing something productive, that you've done something positive. I think for parents and for kids, there are lots of different domains we evaluate our competence in. So for example, am I a competent parent? Am I a competent person at work? Am I competent in my own self-care? And so that's overwhelming to have all these different domains. And sometimes we may be upset. I'm having to be more competent at work and I don't have time to do that at home. Or kids in college or school saying, I'm being forced to be, competent in academics and I don't have time to do it in other places. So it's recognizing those domains, recognizing at times which ones may be more important. And then, like we said, taking it back a step to say, we can start with competence in small things. So for example, today I showed I worked on things such as taking pills, going for a walk. So giving yourself more positive feedback and regard. We're often meanest to ourselves, most critical of ourselves. So allowing ourselves to receive positive praise is really important and hard. And then the last is confidence. So thinking generally about our hopes and our strengths and thinking about what we are hopeful for in the future, what brings us hope, and how we might seek other things that are kind of giving us meaning in life. When we talk with kids who are experiencing or parents significant symptoms of depression and maybe thinking about, is life worth living? We are often talking with them about things like this. What are your reasons for living? What things do you enjoy that are keeping you connected and keeping you happy? So this was just a brief introduction. We have more handouts. There are access to lots of resources about this online. They expanded this in lots of settings beyond the military. And so wanted to offer this as one conceptualization for different strategies to try. So I think that's the end of our slides. I can take us out of them and then open it up to conversation and questions, and can open them again if helpful to see. And like Ellen said, we have handouts with lots of this that has been developed within our center by the Mental Health Advisory Committee for the CF Foundation, and also are available on the CF Foundation page. As Ellen said, lots of blog posts written by people with CF or parents that can also help you feel connected to similar experiences. Ellen and Amy, would you say anything else in summary?
Oh, that was wonderful.
Yeah, I'd be interested to hear what questions people have.
This is Jill. Might be a little bit of a loaded question, but just curious. I've just heard some rumblings in the CF community about the tie between some very, essential, highly effective medicines and mental health. Is this something that you're noticing in clinic? I'm just curious about the real experience, that the providers might be noticing.
So yes, definitely we have seen that and have worked with several people around that. We've seen not only worsening anxiety or depression for some people, but also symptoms related to what we might call executive functioning. So attention, distractibility. So really important that we think about timeline of when certain modulators are prescribed or started, and onset of mental health symptoms can also be hard in terms of, again, what else might be going on. But we have had some people who have changed their dosage because of mental health side effects, or people who have increased, for example, in SSRI in relation to it. So it's something that there is lots of research going on. There have been more presentations around this in the larger CF community, and really important for people to know about and talk to their providers about.
Thank you. That's helpful.
There's a question in the chat from somebody who says, I was wondering what it looks like to support someone with CF and getting support from their workplace.
I'm curious. So let me see. So again, with in regards to support from workplace, is there more you might say on that? Or Ellen and Amy, you might be better able to respond. Is that in terms of mental health support, resources, accommodations? Okay.
There are federal laws that protect your rights at work through the Americans with Disability Act. There are responsibilities that the employee has, and there are responsibilities that the employer has. The first thing that I always suggest is to meet with your employer, your HR department, and disclose your illness, and have a list of accommodations along with a letter from a physician that spells out what the illness is, and to not necessarily sign anything until you have all of the accommodations in place that you're interested in. Just one last little plug about working with CF. Beth Suffian, who is our guru about accommodations and rights and the law, always suggests for people to be thinking about working at a place that employs 50 or more people, because they will be able to take FMLA and on an intermittent basis, or the 12 weeks of FMLA, and you can save your job that way. I don't know, Ellen, you probably have more to add to that.
No, I mean, that was great. That was a lot of really good information. And absolutely working at a larger, working in a larger environment can be beneficial because of the legal requirements that the employer has to provide around FMLA. One thing that I think can be helpful with getting accommodations, whether it's in a workplace or in a school setting, and in a school setting, we have a little bit of a different set of conversations. But providing your employer, or providing whoever it is that sort of helps make these rules, right? Providing them with education. They have very likely not encountered or not met somebody with CF, and so they don't really know. They're not necessarily purposefully doing anything wrong or harmful, but just some education can really go a long way. In my experience working with, so I have a lot of teenagers that I work with. In my experience working with our teenagers, they have not gotten a lot of pushback. So people tend to want to be accommodating, is what I mean to say. Yeah.
I have a question. I don't want to question all of y'all works, but I'm just curious. I've been thinking about it a lot. You have a family that just moved. A kid and the mother came for the first appointment. You was able to acknowledge that kid depressed or stressed. You see that mother has depression, but she's not acknowledging. She doesn't want to agree about that. What gonna be your action about talking her through, offering her help? What will you do about that?
It's too hard when there are three of us. We keep looking at each other to see you answer. No, you answer, right? I think you bring up such a good point, Tatiana, in terms of, I had a supervisor who used to say you have to meet people where they are. And so if we jump and say, you seem depressed, you need resources, then a lot of times people may push back. And so we have to be ready to kind of gently introduce the idea of things that we may be worried about, or ways that we can offer more support to someone, and then kind of following along to see when they feel like it may be a good time to reach additional support. We have lots of different ways too. I think for some people, there's still stigma around mental health. I have some kids who have asked for therapy and their parents haven't wanted that, or have been really hesitant, or worried, why can't you talk to me? What does this mean? And so there is also lots of education around that, and how there are different forms of support, from kind of check-ins to therapy to medications, right? There's a lot that we can offer, but I think it's so important what you bring up is that we can't assume that identifying symptoms means someone wants or will receive a certain type of support. I should look to you, Tatiana, and ask you if you think there are things we can do better when we meet those families, or ideas that you had in mind.
Wait, oh, wait.
That's mean to me.
I mean, on my own experience, when we moved to this country and then had a baby, and what happened in our life back there, and our first appointment, and then meeting all the nurses and the whole team, and receiving the questions, when I build the wall around myself that I don't want to talk about anything, like I would put the smile on my face, everything's fine, not just because I didn't want to talk about it. It was easier not to talk. It took me about over a year to acknowledge that, yes, I need help. Yes, I need some support. And that's when I think Mark was smaller when we started support group. And then after that, I got more support. And, I think as a social worker and mental health worker, there should be a way talk with parents and reassure them it's safe to open up. Of course, they will not do it on the first appointment. It takes time to get used to and know you, and just takes reassurance for us to open up and make sure it's safe. That nobody will knock on our door just because we're in a bad shape and there's one get out from the bed or something. Just simply take care of yourself, brush your hair or something else like that. But I think those parents who have depression, you as a mental worker, you can see that when they come into a clinic. You can see that even talking with them, when they're saying everything is fine, everything is perfect, you can see by the way they talking, the way they moving their hands, and all these actions can show that something is wrong. I don't know. That's it.
I appreciate that. I think it's really important, and we may sometimes think we know and we don't, though. That's the other important thing, right? But our natural human tendency too is, how are you? I'm fine, thanks. How are you? Or how do you think I am? Right? And when you come to clinic visits, a lot parents will say, well, I'm here focusing on my child, I'm not here to talk about my mental health. And so that can be hard for parents too. The CF Foundation encourages us to talk to parents and to screen parents and offer that opportunity. And we've had mixed results in terms of some parents being very appreciative and others kind of saying, this doesn't feel right. So it's an ongoing thing that we're learning. So we appreciate you giving us feedback too.
I just
think
kind of add really quick, actually, to what Amy does for me. Amy finds secret keywords that I say and then automatically connects it to a resource. And she's like, well, if I'll say we're having issues with this or whatever, and she's just like, send it to me, or this or that, and it's giving a resource as well. And sometimes filling out the paperwork and getting involved and doing all that. Cause I'll be honest, I hate to say, I've had a hell of a couple of years, and there's been some serious hardships where I can't pay my mortgage. And I'm like, Amy, I'm scared. I don't know how we're going to eat, or I don't know how we're going to pay the mortgage. And she'll have to get that out of me, but there's certain keywords. I'll be like, well, things are okay. Money's a little tight, but we're doing okay. Really, I can't pay my mortgage. I can't feed my kids. I'm going through this and that. She's like, well, where's when you say money's tight, well, where's it at? And then all of a sudden, before you know it, you've got gift cards, you've got Farm Fund, you've got Garrett Foundation, and it's just those little keywords and those little things and then you find that the help is okay to accept. It's okay to accept help, and allowing people to step up and help you. But I think that's something Amy's really good at. I don't have as much time talking with Mary Beth or Ellen as I do Amy, but is finding those keywords and just offering a resource, or offering, a hand, or just listening. That was my big thing. Is I suffered from a lot of pride, but I got to a point where you gotta bend, because you got to find a way to feed your family, so I think kind of just, you guys pick up on the keywords and offer resources, and before you know it, it's just, you've got help, and then the help feels good, and then you just kind of continue with it. But Amy's definitely good at those, just, oh yeah, things are a little tight. Well, what do you mean? Like, can you give me, and then before you know it, it's not tight anymore, and so I don't know, just wanted to throw that out there, and also brag on Amy, because she's really, through just keywords, and she's saved our family this year. So thank you for that.
I think that, one of the things that gives me such joy with my job is, like what Tatiana said, and what Sam said is, just meeting people where they are and building that rapport first. You don't know where somebody is at until you get to know them, and that you build that trust. And sometimes if you can, lend a hand, sometimes with something concrete, that goes, toward that rapport. But building trust is really important for parents, to kind of let that guard down. And it's also, I feel like part of my job is to let them know that, their mental health is just as important as their child's mental health, and that their child is going to, you're modeling to your child that it's important to take care of yourself, that you're worthy and you're worthwhile, and that it's important to, take care of yourself so that you can be there for somebody else. So.
That's so true. I remember when I went to the doctor and received the help, and Amy was our social worker, and I'm calling her with the tears, not knowing what to do. What's that mean? And because I came from the different country and their stuff is completely different. If you're receiving help, that means you're completely out of your mind. And then here I'm calling Amy with the tears crying in the parking lot saying this happened, and she's calming me down, saying stuff like, she knows what to say. She feels. And it was so important to hear what I heard on that conversation and receiving all the help and everything, and then coming to appointment, and she would ask, how are you doing? Not just your kid, how are you doing? Are you getting better? How are you feeling? Are you enjoying your life? So it's really important. This small questions makes our days better, makes us to realize, hey, yes, something is wrong. Yes, I'm not able to enjoy my days. Maybe I should ask for resources. Maybe I should reach out privately to my social worker and ask for resources, not in clinic, because different parents feel differently. Some doesn't want to open up. Some afraid of something. But building this trust is something that can't be replaced. It's so important when you have the trust, when your social worker open to you, you can be open to your social worker and talk honestly instead of putting the face mask, smiling, and having these walls up saying, I'm fine, everything's fine. But I think our UNC team is the best. I mean, I haven't been to any other clinic except the different experience from other country, but hands down, I'm always voting. Our UNC is the best 24/7, and you can't find a better care. You have all the resources, all the help that any parents will ever need. They just, some needs to learn how to trust and open up.
We should have warned Amy that this was an intervention to say we love you, right? When we just, that whole first hour presentation was a scale. Oh, I'm kidding. But I think it's true. We all love Amy and lucky to work with her. Ellen's okay, but Amy's pretty awesome, right?
I'm sorry, I will eat. I
Okay.
think everything comes with experience. Ellen doing such a great job. After our other meeting, she listened to us, and then our last appointment, she came and she said, hey, I know even talking to parents differently, starting a conversation from different way, and it is change. Everyone comes with experience. So she's great. She's hands down great. And with more years coming with the UNC care team and the families, more she's gonna learn, and more ways there's gonna be to open up parents for conversation.
Tatiana, we appreciate you and all of your wonderful feedback. Thank you for sharing what your experience has been. And it's always a delight for all of us to see our families.
And I'll put a plug in for Mary Beth as well. Thank you. No, we really appreciate that you all presented tonight. So I don't know, does anyone else have any other questions about anything relating to mental health or accessing it or how to access it for, I don't know. I have a couple post-polling questions that I'm going to post, but I wanted to just wait and see if anyone had any more questions. So thank you very much for coming. Oops.
Thanks. Good to see you all. Have a good night.
Thanks. Good night, everybody.
Have a
night.
good night. And hopefully we can meet in person at some point, but we're still going to keep the virtual aspect. So thank you.